When does this earwax turn from being helpful to harmful?
They may damage the eardrum.
Is using cotton earbuds safe for the ears?
That the hard impacted wax may become swollen. Just like a dry seed, if you put into water, after some time it gets expanded. No,
You might do more harm than good.
they should come back to proper specialist in that field.
What are the top tips that you advise when it comes to cleaning the ear? Jai Shri Gurudev. Namaste and welcome to BGSMCH Aarogya Vani. Your health, our priority. I am your host Dr. Anu, and in this episode of Aarogya Vani, we will be discussing a very common ear problem. Let me ask you something. Have you noticed a strange sensation in your ear as if your ear is blocked? A weird sensation which is constantly there. When does earwax go from being helpful to harmful? How will you know that you need to meet a doctor? And more important, is it always right to clean earwax with cotton earbuds? Don't worry, we got all this covered for you in this episode of Aarogya Vani. Today, we have with us highly respected, very well experienced, our expert from BGS Medical College Hospital, Dr. Venkatrajamma Madam, Professor and Head, Department of ENT, BGS Medical College Hospital. Hello ma'am, a very warm welcome to Aarogya Vani. It's a pleasure for us to have you with us today.
Thank you very much. Thank you for inviting me for this program. I will be very happy to share my knowledge regarding the topic you have selected.
Okay ma'am, to start with the discussion, let us have some basic questions covered. What is earwax and why do we even have earwax to begin with?
Actually, it's a God-given defense mechanism to protect the ear. As you all know, the ear has got three parts: external, middle, and inner ear. So the border between the external ear and middle ear is the eardrum. It's a very delicate structure to be protected, which has been exposed to outer environment. It can be mechanical or chemical or acoustic also. So for that sake, the external canal is created in such a way that it is not straight tube-like. It is almost like an S-shaped. And in that also we have two parts. One is a fixed part, that is bony part. The outer is the cartilaginous part. So the deviation or curvature can be corrected by moving the external ear, pinna, what we call it as, so that you can visualize the eardrum or any structure or any defect or any disease by straightening changing the position of the external ear. So wax is also one of the protective mechanism which has been secreted within the external ear skin. Actually, the skin has also got some variations. The inner bony part has got only superficial layer. The outer cartilaginous part is covered by normal skin, whatever you see in the face and all. It has got all the glands, like sweat glands and oily secretions to make the secretions thick and sticky. So by creating such secretion, God has given a defense mechanism wherein the foreign bodies will be adhered to that sticky material. So the combination of the external desquamated skin excreted out from the inner ear, the inner part of the external ear, and the secretions from the outer part of the external ear will get mixed up. So it becomes sticky and becomes wax-like.
Okay, so earwax is something produced naturally.
Yes.
And it protects the ear canal. Yes. When does this earwax turn from being helpful to harmful? What is impacted earwax?
Actually, depending on the nature of the person, few people will be sweating more, a few people will be having very oily skin. So depending on that, the secretions will be watery, oily, or it can become semi-solid also. And depending on the area of the patient, as a person, staying, the outer temperature, occupation, all these things will affect the external air also. The temperature will be varied, so that the secretions become thicker and dry. And by nature, if the people are sweating more, they'll have more secretions. And those who are having less secretions will have less. Clearance is not, it's naturally by movement of the jaw, it will be pushed outside from the inner to the outer ear. And it will be cleaned automatically, naturally. And sometimes it gets blocked because of anatomical variation of the external ear. It may be narrow, or any elevations and depressions, or any disease of the skin of the ear. It will hinder the natural movement of the wax to externally get impacted. So that time the patient can have impacted wax.
Okay, so there are various factors which lead on to the natural protective mechanism becoming impacted earwax. So, like personal factors, some ear diseases, and lifestyle factors as well.
Yes.
Yes. Is there any high risk group or people who are more prone to develop impacted wax?
That's what I told him. There is excessive secretions with obstruction. Patient can have more of secretions get impacted because of mechanical blockage.
Usually people clean the earwax with cotton buds. This is a very common concern that majority of the people are having. Almost everyone would have used earbuds to clean the ears. What is your opinion? Is using cotton earbuds safe for the ears?
Using cotton earbuds under vision is always good, because somebody has to see and do it. Blindly inserting the earbuds into the ear is always dangerous. Especially in common people, they will not understand the anatomy of the external ear and the importance and delicacy of the eardrum. They may damage the eardrum, or push, if the secretion is too thick, they will push the impacted wax deeper inside into the external canal, which will be difficult to remove it. So in such cases, they may damage the ear as well as the eardrum also.
Okay, so if rightly done, it might be useful. But if vision is not there, if you are not able to see it, and if you are able to do, you might do more harm than good.
Yeah. In addition, if the secretion is oily, watery, earbuds can help by removing it delicately. And if the secretion is too thick, it's difficult for them to get it removed.
We have heard about people using oils and warm water to clear off the ear. Ma'am, with your experience, have you heard about any such myths or misconceptions?
Usually patients, as soon as they feel there is a blockage in the ear, they think it's only because of wax. There will be so many other reasons also, just like upper respiratory infection sometimes. There will be blockage of nose and there will be sniffing. And there is a connection between the nasopharynx and the middle ear through an eustachian tube. It gets blocked when there is sniffing, and it draws whatever the air within the middle ear into the nasopharynx. It becomes negative pressure. So in middle ear, when there is negative pressure, the inner ear, tympanic membrane will be pulled inside, and the hearing will be reduced. So because of that reduced hearing, the patient will feel that there is a blockage in the ear, and they start doing maneuvers to remove the wax when there is no wax also. So then during that time, they might damage the eardrum by instilling any home remedies like hot oil or any wax solvent drops, which can directly get installed onto the surface of the eardrum, which might get damaged and get perforated sometimes.
Ma'am, what are the most common symptoms with which the patients with impacted wax present to you?
First most common is reduced hearing, and sometimes they feel tinnitus, like extra sounds like, and sometimes they may feel giddiness also because of that. And sometimes there will be pain also. When there is impacted wax, when there is installation of water inside, when they may take bath or they go for swimming or anything like that, that the hard impacted wax may become swollen. Just like a dry seed, if you put into water, after some time it gets expanded, no? Like that, the wax may get expanded and they put the pressure on the surrounding surface of the confined area of external canal. It might be bony or cartilaginous part, especially the bony part. There is no place for it to expand. So because of that expansion, the patient may feel very much ear pain.
Okay, so ear pain, reduced hearing, or some
Giddiness.
extra noise in the ear, or giddiness.
giddiness.
These are the most common symptoms.
Yes.
So once a patient presents to you in the hospital, how do you diagnose this condition?
We just usually check the external ear with external examination only. with proper illumination, light, and see whether wax is there or not. In case if it is really impacted and hard, we have to make it soft by putting some ear solvents. We may advise the patient to come back after 2-3 days after installation of the drops, so that the solid will become semi-solid. It will be easier for us to remove the wax under vision.
So there is no need of any lab investigation or X-ray examination. A simple ear examination can diagnose the impacted earwax.
Yes.
Okay. And once it is diagnosed, how do you plan the removal of the impacted earwax?
So if it is semi-solid or oily, we do it under vision only with proper irrigation with a warm saline or any hydrogen peroxide diluted solution, so that it push the debris of the extraocular canal along with the wax. And in case it is contraindicated, in case of if there is a perforation of the eardrum already with ear disease, middle ear disease, or any fractures previously, any surgeries, or any grommet insertions we do for children, especially following recurrent otitis media. For proper ventilation of the middle ear, we insert a tube, ventilating tube. In such cases, we should avoid irrigation. With manual curating, we can remove it, or suctioning, we can remove it.
Okay, so according to the condition of the patient, for few patients might be ear drops to make it soften it, and then you go for the removal of the impacted earwax. Saline irrigation also is also done in some
Warm.
specific cases.
Yeah, warm saline.
Okay, so it is better to leave it to the doctors to decide what is the approach. What are the complications if at all this impacted earwax is not removed?
Sometimes because it is ceruminous secretions and sebaceous secretions have got some enzymes also, which has got bactericidal effect, and it may damage the external surface of the ear. Sometimes if it is left for too long, it might damage the subcutaneous tissues also.
So is there any prevention advices that you can advise, like home remedies, in order to prevent the impaction of the earwax?
Sometimes if it is very scaly and dry, they can instill some neutral oils like olive oil or baby oil to make it soft, and with proper rotatory movement and proper knowledge of the depth of the external area, you can clear yourself. Especially after having head bath also, sometimes it becomes wet and soft. If it is too sticky and waxy and they are not able to clean themselves, they should come back to proper specialist in that field.
Okay, so it's better to get a ear screening done also, evaluation, so that such, according to the condition of the patient, you can assess and give some opinion.
Yeah,
regarding
patients
that.
also sometimes they can come to the doctor when there is discomfort and distress or pain because of, if they feel that there is because of wax only, they should get it confirmed and get it treated.
Okay, ma'am. The final question. What are the top tips that you advise when it comes to cleaning the ear?
Cleaning the ear, as I told you earlier, they can get it done themselves when there is very little secretions like oily or scaly dry secretions. And if it is very thick and impacted wax, or patients with grommet insertion, or as I told earlier, post-operative patients, ears undergone ear surgeries, or any skull-base fractures, or any dehiscence, they should come to doctors only for cleaning. They should not attempt themselves at home.
Thank you, ma'am. Thanks a lot. It was a clear and a very informative discussion. Thanks for taking time out of your very busy schedule and spending time with us in spreading awareness regarding such a very common problem, ear problem, that is there in the community. Thank you. Thanks a lot.
Thank you so much for giving me this opportunity.
Dear listeners, if you or someone you may know is having similar complaints as we discussed, ear pain, itching sensation, some extra noise in the ear, blocked ears, please do get a medical opinion. Get a consultation from ENT specialist and then do as it is advised to you. With that, we have come to the end of this episode of Aarogya Vani. Hope it was informative. If you like this, please do like, share and subscribe to our BGS Medical College and Hospital YouTube channel. If you have any doubts related to this topic, Please do mention in the comments below. With that, we conclude this episode. This is your host, Dr. Anu, signing off. Jai Shri Gurudev.
If you enjoyed this video, don't forget to give it a thumbs up, share it with your friends, and hit that subscribe button for more exciting content.